Hello, and welcome to your newborn's discharge information video. My name is Samantha, and I'm a nurse on the Mother-Baby Unit at the Ottawa Hospital. In this video, I'd like to talk to you about signs to look out for when you bring your new baby home from the hospital. If you notice any of these signs, please call your baby's healthcare provider or go to the nearest children's emergency department. Over the next few minutes, it may be overwhelming to hear all the signs to watch for, but we review them to make sure you know when to get help if your baby needs it. You do need to take your baby to see their healthcare provider within 2 days of leaving the hospital. This is a chance to ask any questions you might have, and your healthcare provider will look out for some of the conditions I will talk about in this video. If you're unable to make an appointment with your healthcare provider or don't have a healthcare provider, the nurse will arrange a follow-up appointment for your baby at the Monarch Clinic. You'll need to bring your baby's temporary health card and the baby's first week card to your baby's follow-up appointment. Remember to return the top portion of the health card form to your nurse before leaving the hospital. Keep the bottom portion. This is your baby's temporary health card. Helpful tip: take a picture of the bottom portion just in case you lose it. Before I continue, please note that the information in this video is not medical advice. Some of it may not apply to you. If you have any questions, please talk to your doctor, nurse, or other healthcare team member. For urgent matters, please call 911 or visit your nearest emergency department. Alright, so let's get started. The following are 9 signs to watch for in your new baby that require immediate attention from a healthcare professional. A fever. A fever is considered a body temperature of 38 degrees Celsius or 100.4 degrees Fahrenheit or higher. You can take your baby's temperature by placing the tip of the thermometer in the armpit. Signs of a seizure, such as sudden, repetitive twitching of the arms and legs that does not stop by gently holding them, not waking up, and/or body stiffness. This is a medical emergency. Seek medical attention immediately or call 911. Signs of illness and/or respiratory distress, such as difficulty breathing, very fast breathing, you hear continuous noises like grunting with the breathing, baby is pale, blue, or gray in colored in the face, is choking, and/or stops breathing. For any of these signs, call 911 or seek medical attention immediately. Signs of jaundice, which include your baby's skin turning more yellow, the whites of your baby's eyes are yellow, and/or if your baby is hard to wake, is fussy, or not feeding well. Signs of dehydration and poor feedings, such as if your baby is feeding less than 8 times in 24 hours. Normally, babies should feed every 3 hours or sooner if they need it. If your baby has diarrhea, watery green poop, or pale white looking poop. If your baby has less than the normal amount of wet diapers or poops, please check the signs that feeding is going well chart to see how many wet and dirty diapers your baby should have. You can get this chart inside the yellow crib card that's placed in the bassinet. If uric acid crystals persist. Uric acid crystals look like red, brick-colored stains in your baby's diaper. It is normal up to the first 3 days after birth. But if the stains are still there after 3 days, this is a sign of dehydration. If your baby is throwing up large amounts, more than just spit up, or has greenish colored spit up. And lastly, if your baby has dark colored and/or strong smelling pee. Signs of infection in the umbilical cord, such as redness, leaking fluid, a bad smell coming from the umbilical cord, and if the cord does not fall off by 3 weeks after birth. Signs of an eye infection, such as eye irritation, leaking that is yellow to green in color, swollen eyelids, eye pain, or tenderness. Signs of sepsis or infection, such as a fever with a temperature of 38.5 degrees Celsius or 101.4 degrees Fahrenheit or higher taken in the armpit. Fussiness, drowsiness, feeding poorly, difficulty breathing or fast breathing, stiff joints in their hips, knees, or ankles, swollen reddened patches on their face or neck. It is especially important to watch for these signs of infection if you're a Group B strep positive during your pregnancy, as your baby is at risk of an infection for the first 3 months of life. Other signs of illness. Other signs of illness to watch for include if your baby has a pale colored skin, looks unwell, is not interested in the things around them, is hard to wake, is not feeding well, is crying and will not settle after feedings, has a high-pitched cry, has a rash that will not go away, and/or if your baby is having long periods of sleepiness or fussing. If your baby has any of these symptoms, or if you feel like your baby needs medical attention, contact your baby's healthcare provider. If you're not able to contact your baby's healthcare provider, take your baby to the nearest emergency department at your local children's hospital, such as CHIO. For more information about bringing your baby home, take some time to watch our other video on frequently asked questions and baby safety. A link to that video will be in the caption below. Thanks for watching.